course of the pandemic, mental health has come to the forefront of the medical community and of greater society. And now as COVID-19 cases continue to drop and the pandemic seems to be slowly fading into the rearview mirror, the question then has now arisen, should I continue with online therapy or is it time to go back to in-person counseling? Joining us to answer that question and more is Dr. Brooke Weingarden from the Birmingham Maple Clinic. Dr. Weingarden, thank you for being with us again.
Hi, thanks so much for having me.
Appreciate having you on. So during the pandemic, online therapy became the norm for safety reasons. It's become the norm, or it's become more of an option across the board medically and in other businesses as well. As cases continue to drop and things are getting more and more back to some sense of normal, have you noticed that online therapy sessions have also reduced? Have they stayed the same?
I think that there are a certain subset of patients who have requested to come back to in-person, whether they are young children who don't have much of an attention span because of ADHD, or if they really are needing more one-on-one redirective. But I'm seeing a majority of patients are really enjoying continuing with online therapy. There have been so many benefits, including just saving time for travel, having to pull children and people out of school and people out of work. And it's been so convenient to have that accessibility to your therapist.
Who have you found in your experience and from discussions with other professionals in your industry, who have you found to be those that online therapy seems to be more effective for versus in-person counseling?
I have experienced, as well as many of my colleagues, that the majority of patients have done really well with online therapy. There have been multiple studies that even prior to the pandemic that have been exploring this, as telehealth was something that was starting to come into fruition as a way for accessibility for patients in rural areas that didn't have access to care, and really have been finding that the benefit using online therapy and the benefit using in-person therapy is very similar. And I think that that's been something that's really important to remember. So most patients really have found benefit in online. So I don't even know that it's a specific. I would say the majority of patients have really enjoyed continuing online.
So for those that are seeking therapy or have been actively in therapy, maybe online, maybe in person over the last several months, or a combination of both, what considerations should they be keeping in mind as they make a decision whether to continue on with their counseling online versus in person, or some sort of an in-between workaround?
Yeah, I mean, I think the thing to remember is, the fact that we have online availability is allowing so many more people to have access to care. So someone who may have not been able to get to therapy because their work schedule or their school schedule, or they're just too busy, or their children, can take an hour out of their day, step into another room, and have access to that therapy. So people with busy schedules really are benefiting from having that online option. People who are not comfortable with travel, people who people who have a good connection with their therapist. And that can be from the very first appointment even. It really doesn't change that connection whether you're in person or online.
So are there any certain conditions where a therapist may believe that it is best for a patient to have an in-person consultation versus online?
I mean, there certainly would be. There are some conditions such as, eating disorders where you really need to see a person in person, whether they need to be, monitored as far as their weight, or you need to, see the entirety of their nonverbal communication. There are some patients, again, I think that the kiddos that I see with ADHD have a really hard time sometimes with online therapy because their attention span is just not there. Some of the more defiant kids that struggle. I think kids, for the most part, have done better in person just because they feel more of that connection. They feel like they're away from siblings that could possibly be listening to them. They think that they can get a little more engagement that way. That being said, I have lots of kids that I see who have done really well online, but that would be a subset as well for people that are needing to be in person.
We're joined by Dr. Brooke Weingarden from the Birmingham Maple Clinic, joining us on the Michigan MegaCast. More information on the website, birminghammaple.com. That's birminghammaple.com for more information and for consultation. Dr. Weingarten, have you found that there are certain personality types that respond better to online therapy or telehealth versus in person? And how can those differences in personality types ultimately lead to more effective care if it is online or if it is in person versus the other?
I have found, especially at the beginning of the pandemic, those of my patients that are either a little more timid, that have more social anxiety, that may be a little more nervous about talking about certain things, maybe with some trauma history, maybe that are just a little more resistant and hesitant to the idea of talking about things, have done really well with online treatment, because something about having that the computer screen in between you is like a separation a little bit. And I think that people feel a little more comfortable then that you're not sitting directly in front of somebody. They get a little less nervous about being able to verbalize certain things that are on their mind, which is wonderful because it's a little easier for them to open up.
We're joined by Dr. Brooke Weingarden from the Birmingham Maple Clinic with us on the Michigan MegaCast. More information on their website, birminghammaple.com. That's birminghammaple.com for more information and for information as well on consultation. And so we've seen during the pandemic that particularly anxiety and depression have been very common ailments that have either come more to the forefront of people's medical existence or their needs in terms of therapy. As we're starting to come away from the pandemic and into whatever normal is going to be going forward, are you seeing or do you expect to see some of those similar feelings relapse or come back to the forefront also, because there's also this great unknown ahead of us with what does it mean to be post-pandemic?
Absolutely. So I am most definitely seeing I don't even know if it was a dip and then a surge, a continued surge of anxiety and depression. I think we've gone through many transitions throughout the last several years, going from, normal life to lockdown, and then to all virtual, and then to in person with masks. And, all the different changes have created so many transitions for us. And this is yet another transition with an unknown. And the pandemic is still, it's not completely gone. So I'm absolutely seeing a lot of anxiety, social anxieties, panic, depression, trauma, while people are also somewhat processing everything that they've just been through, yet there's still some fears about the future, about, finances, health, all of the things that we have been experiencing, but continue to be magnified.
We're joined by Dr. Brooke Weingarden from the Birmingham Maple Clinic with us on the Michigan MegaCast. For those that may be having these feelings pop up, maybe they felt these feelings before and kind of ignored them, or they haven't been so severe or so severe or so visible to them, visceral to them, that they have just sort of passed them by in the past, but now it's at a point where they're feeling this is something that's not normal for me, I'm not feeling quite right. Where should that process start in terms of seeking therapy, looking for the right therapist, determining whether to go online or in person? Where should that process really start for each individual?
So that's a great question. And I get that question a lot from patients and friends in the community. Oftentimes, I think going to your primary care physician is a really nice home base to start, because they will often have therapists and psychiatrists and other mental health professionals who they would recommend to start with. They can really guide you of who they like to work with, who they feel comfortable with. if you are already working with a therapist, you may feel that you need to speak with a psychiatrist or vice versa. Sometimes you might ask a friend if there's someone that, that they've liked, or if there's another professional, somebody that they've liked. Asking around is good. And if you really don't have anyone to ask, you can always look on the back of your insurance card and see who is covered. They always will have a list of mental health providers on there. And it's a good idea to sort of read through. Now, I always emphasize to patients that the most important thing is the fit. If it's a good fit, you're going to find success in therapy, whether it's online or in person or any which way. If you don't feel like it's the right fit, it's okay to continue to explore and find somebody else, because they might be the most wonderful therapist or physician in the world, but if it's not the right fit for you, then it's not going to be as successful. So it's okay to meet a few people. It's okay to try it out and feel that you need a change.
So it's going to be different for each person. It's going to be different for each professional on the other side, whether it is a psychologist, a psychiatrist, a therapist, whomever the patient may be visiting. For you and for other colleagues of yours in the industry, that first visit with someone, can you give us a walkthrough of what sort of is that first visit like? I know it's obviously going to be different from one person to another based on what they need to talk through or what conditions they may be afflicted with. But generally speaking, what is that first visit like?
So whether you're seeing a therapist, whether it's social worker, psychologist, whether you're going to see a psychiatrist, a lot of people are very nervous because they're not quite sure what's going to happen in the first visit. And I would like to reassure you to say that, the first visit is really just somewhat to get to know you. What's bringing you to see me? Tell me a little bit about what you've been experiencing. Let's talk about your sleep habits and your appetite and some of the day-to-day things that you're experiencing. What are some things that you wish were better? And then you get into a little bit of, family history, medical history, history of treatment. It's a lot of sort of the checkpoints of just wanting to make sure that you're getting to know that person. And if there are questions, I have a lot of patients that say, I'm really nervous about therapy because I don't know what to say. I don't know what I'm supposed to do or which type of therapy I need or what to tell them. And I remind them, yeah, of course you don't. That's not you don't have to know those things. If you're working with somebody, that is our job to know how to direct you and how to figure out what's the best course of action for you. So you don't have to know any of those things. We're really taking some time to get to know you, to figure out what the best treatment modality is for you. And that could be therapy, that could be medication, that could be a combination of both. And
so on the other side, for patients, what are some of the questions that you as a professional that is providing this therapy to them, this counseling to them, what would you and other professionals like from them, if they are to ask any questions, what should they be asking of the professional that they're visiting in their first visit or in their opening visits to kind of get that information back and that feedback themselves so that they can determine if this is the right fit or if they need to go look and seek another professional?
Sure. I think part of the right fit is also sort of personality meshes. And that's the type of thing that's not specific for a checklist. If you feel like you're comfortable, if you feel like you can talk to someone and you feel like you're not judged, you feel like you're in a setting where, okay, I think that I could open up and this person seems to get me. That's a huge plus. And that's a bit, that's more of an internal feeling. But sometimes it's good for a patient just to know, hey, what type of therapy are you recommending? Is there a certain, regimen that you think would be best? How many times a week, would you recommend? Do we have specific goals? Are there specific things that I need to know in order to be, my best participant in this therapy? And there may not, those goals and those answers may change, but it's a good place to start a conversation and to develop that relationship. But a lot of it is really just that internal feeling of, do I feel comfortable? Do I feel like this person really is hearing me? Where I can then take it to the next step so we can kind of work together.
We're joined by Brooke Weingarden, Dr. Brooke Weingarden from the Birmingham Maple Clinic on the Michigan Megacast. More information on the website, birminghammaple.com. Dr. Weingarden, before we let you go, anything else that would be important for our audience to be considering at this time if they are in therapy, if they're considering therapy, or if they're considering whether they should go online or in person or some combination?
I think it's just great to know that if you feel that you're struggling, if you feel like your motivation has changed, you're not interested in things the way that you were, you're really feeling kind of hopeless, you're nervous and keyed up and panicky, and if things are not right for you, if you feel like you're still having a hard time, first of all, you're not alone. There's so many people that are also struggling, and it's always a good idea to reach out and find somebody to support you. We could all use the support. If everybody was working with a therapist, then the world would be a happy place. I think it's a really important thing, and you do whatever you feel works best for your schedule, whether it's in person or online, and just know that both are extremely effective. Both are equally effective. You're not losing anything by taking one versus the other. So if it works for you to only be doing online, wonderful. At least you're there, and at least you can find that support from someone.
Dr. Weingarten, thank you so much.
Thank you so much.